Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Exiged Duo. So Exiged Duo tablets contain a combination of Dapagliflozin and Metformin. So Dapagliflozin and Metformin are oral diabetes medicines that help control blood sugar levels. Dapagliflozin works by helping the kidneys get rid of glucose from your bloodstream. Metformin lowers glucose production in the liver and also causes your intestines to absorb less glucose. So Exiged Duo is used for type 2 diabetes in adults aged 18 years of age and over. These tablets are licensed for use in people with type 2 diabetes whose blood sugar is not controlled by the maximum tolerated dose of metformin alone, or who are already taking metformin and dapagliflozin as separate tablets. Exiged Duo tablets can also be used for people with type 2 diabetes whose blood sugar is not sufficiently controlled by other anti-diabetic medicines. It can be added to treatment with a sulfonylurea such as gliclazide or glibenclamide, or to treatment with insulin. How does Exiged Duo work? So in type 2 diabetes, the cells in the body become resistant to the action of insulin. Insulin is the main hormone responsible for controlling the level of sugar or glucose in the blood. It makes cells in the body remove sugar from the blood. When the cells are resistant to insulin, this makes blood sugar levels rise too high. Metformin is an anti-diabetic medicine known as a biguanide. It works in a number of ways to decrease the amount of sugar in the blood. Firstly, it reduces the amount of sugar produced by cells in the liver. Secondly, it increases the sensitivity of muscle cells to insulin. This enables these cells to remove sugar from the blood more effectively. Finally, it delays absorption of sugar from the intestines into the bloodstream after eating, so that there is less of a spike in blood sugar levels after meals. Dapagliflozin works in the kidneys, where it allows the body to excrete excess glucose from the blood into the urine. Normally, when the kidneys filter and clean the blood, glucose is filtered out of the blood at the same time. The glucose is then reabsorbed back into the blood by a mechanism called the sodium glucose cotransporter 2. So the kidneys normally reabsorb glucose back into the blood even when the levels of glucose in the blood are too high, as in diabetes. So dapagliflozin works by inhibiting this SGLT2 transporter. This allows excess glucose to be filtered out of the blood and excreted in the urine. This will reduce blood sugar levels. Dapagliflozin has two other effects that may be of benefit for people with diabetes. Firstly, it may cause weight loss due to the loss of sugar from the body. Secondly, it causes a small increase in the amount of water being filtered out of the blood into the urine. This may help to reduce blood pressure. So how do you take Exiged Duo? One Exiged Duo tablet should be taken twice a day with breakfast and an evening meal on a regular basis. The tablet should be taken with food. If you forget to take your tablet at your usual time, take it with food as soon as you remember. However, if it is nearly time for your next dose, leave out the forgotten dose. Do not take a double dose to make up for a missed dose. What should you know before taking Exiged Duo tablets? It is important that you continue to follow the diet and exercise advice given to you by your doctor while you take Exiged Duo. This medicine only helps control blood sugar levels and should not be used as a substitute for healthy eating and taking regular exercise. So who should not take Exiged Duo tablets? So first, people with type 1 diabetes, people with diabetic ketoacidosis, people taking the medicine pioglitazone for diabetes. Also not to be used with people with decreased kidney function, And people with liver problems, also not to be used by people who are dehydrated, people with severe infections or blood poisoning, women who are pregnant or breastfeeding, also not to be used with people who are allergic to an ingredient in the medicine. And Exiged Duo is not recommended for people taking loop diuretics such as furosemide. Exiged Duo is not recommended for people over 75 years of age or for children and adolescents under 18 years of age because it has not been studied in these age groups. Exiged Duo should be used with caution by elderly people, people taking medicines for high blood pressure who have a history of low blood pressure, people with heart disease, also be used with caution with people with a high percentage of red blood cells in their blood, and caution in people with a history of frequent urinary tract infections and people with a history of frequent genital infections such as thrush. Can you take Exiged Duo while pregnant or breastfeeding? So the safety of Dapagliflozin for use during pregnancy has not been established, and for this reason Exiged Duo should not be used during pregnancy. Diabetes is usually controlled using insulin during pregnancy because this provides a more stable control of blood sugar. If you get pregnant while taking this medicine or are planning a pregnancy, you should seek advice from your doctor. It is not known if Dapagliflozin passes into breast milk. For this reason, the manufacturer states that Exiged Duo should not be used by breastfeeding mothers. So get advice from your doctor if this relates to you. So some of the main side effects of Exiged Duo. So common side effects would be low blood sugar levels. And when this is used with a sulfonylurea, such as glibenclamide, or with insulin. Also disturbances of the gut, such as nausea, vomiting, diarrhea. And also common would be a loss of appetite. And vaginal thrush or inflammation of the penis or foreskin due to a thrush infection, and urinary tract infections and difficulty or pain passing urine. Increased production of urine and back pain, dizziness, increased percentage of red blood cells in the blood, and changes in the levels of cholesterol and other fats in the blood, and taste disturbance, usually a metallic taste. If you want any more information about the risks or side effects associated with Exiged Duo, you can talk to your doctor or pharmacist or read the patient information leaflet that comes with the medicine. So can you take other medicines with Exiged Duo? Exiged Duo should not be used in combination with pioglitazone. Dapagliflozin may enhance the effect of diuretic medicines such as furosemide or benzophenylmethiazide, which help to remove water from the body. If you're taking Exiged Duo with a diuretic, your doctor may need to change the dose of the diuretic medicine to make sure that you do not lose too much fluid. There may be an increased risk of developing lactic acidosis if you take medicines that can affect your kidney function with metformin. So these include diuretic medicines such as furosemide, non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen or naproxen. If you are prescribed any of the following medicines with Exiged Duo, you may be more likely to get low blood sugar or hypoglycemia. So your doctor may want you to monitor your sugar levels more frequently if you start treatment with one of these. And they are ACE inhibitors such as captopril and monoamine oxidase inhibitor antidepressants such as phenelazine or isocarboxide, other anti-diabetic medicines such as sulfonylureas such as gliclazide or glibenclamide, or insulin. Medicines that increase blood sugar levels as a side effect may make Exiged Duo less effective at controlling blood sugar. Medicines that can increase blood sugar levels include the following: Antipsychotic medicines such as chlorpromazine or olanzapine and risperidone, beta-2 agonists such as salbutamol or salmeterol, corticosteroids such as prednisolone and glucosamine, estrogens and progestogens such as those found in oral contraceptives or HRT, diuretics such as bendrofluomethazide or furosemide. Octreotide and lanreotide may also affect sugar levels. If you're being treated with one of these medicines, your doctor may want to check your blood sugar levels and adjust your metformin dose if necessary. So the following medicines may increase the blood level of metformin, which could increase the risk of side effects. Your doctor may need to reduce your metformin dose if you take regularly one of these. So cimetidine, dolutegravir, rilpivirine, tenofovir, topiramate and vandetanib. A drop in the number of blood cells called platelets in the blood has been seen in some people taking the antihistamine ketotifen in combination with metformin. The manufacturer of ketotifen recommends that it should be avoided in people taking metformin. So that brings this video to an end. If you have any questions, you can contact us through our website mytelehealth.info or call to Lynch's Pharmacy, Douglas, Cork, or you can ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.